Let's move now to the next presentation, please. So I'd like to introduce Sam Willitts now, who's the Head of Sustainability from Bristol, North Somerset and South Gloucestershire Integrated Care Board. Sam, thank you for joining us today.
Hi, thanks. So I'm going to talk about our project towards zero waste operating theatres. Next. So we're a big hospital precinct in the west of England, in the centre of Bristol. It's a large group of hospitals with about 13,000 staff that serve around 500,000 people. And we're part of the National Health System, which became the world's first health service to commit to reaching carbon net zero. But the trust itself wants to be a real leader in sustainable healthcare, and is even more ambitious and has set a 2030 net zero carbon target. We want to lead our community in improving the environment, tackling air quality, and the use of single-use plastics. Next. So let's dig into the problem a little bit of what we're facing with. Our operating theatres are the most resource-intensive area of our hospitals, using lots of energy and lots of single-use items. 30% of the waste generated in operating theatres, and much of that is in our theatres, and much of that is single-use plastics. So we've got a big problem, and it's definitely the area to focus on is in our theatres. And we recognise that what we really need is to take a different model of how we use those resources. So how do we become zero waste operating theatres? Next. And we understood the problem. It took us a while to think through exactly what our aim was. And we narrowed it down to drive the transition to circular solutions and reduce the single-use plastics in operating theatres, with the ambition to move progressively towards zero waste operating theatres. Next. We went into the discovery phase and identified our stakeholders, but the engagement side of it wasn't so straightforward. It's definitely a bit of a challenge. We looked into analysing our purchasing data, which gave us the scope, which turned out to be very broad. When you think about an operating theatre, there are hundreds, if not thousands, of different products. We looked to do waste audits, but that was delayed considerably due to the pandemic. There were a lot of other priorities at that time. The really key part of the discovery phase was our staff are the most valuable source of information and ideas. Next. So focusing on what our actual requirement was, we looked at the products and services that we would need to support us getting into a zero waste operating theatres. We knew we wanted to reduce the amount of single-use items, the packaging, and the carbon emissions from producing them. We wanted that any remaining packaging to be 100% reusable, recyclable, or compostable. And really where we want to get to is transitioning to a circular material flow and multiple use items rather than single-use items. And we need to make it easy for people to make the right green choice in their purchasing. And we need to find a way to bridge the gap between our policy and what actually gets purchased. Next. So we entered into consultation with NHS England nationally and Healthcare Without Harm Europe, who helped us get the wider picture from across Europe, and they helped us to refine our requirements. And a statement of demand was published and widely communicated. That statement of demand had loads of interest and support from a wide range of NHS hospitals and other organisations. The feedback we received helped us refine that into a joint statement of demand, which ended up with more than 20 organisations supporting it, the initiative, and that shared the same unmet needs. Next. So knowing that there was a demand for this unmet need, we went to the market to consult them. This was a really interesting, exciting phase. It was intentionally a really broad approach to enable the team to find out what was possible, what could the market do. We wanted to hear directly from the supply chain about what their interests were, capability, and the capacity to offer solutions that met our requirements and overcome the challenges we faced. I'm really pleased we had a really great response. We got returns from a wide spectrum of sectors, and out of the 30 responses received, 60% of them were from SMEs. Next. So the market gave us really useful feedback on the different options that were already available or could become available. And we found out about some existing solutions which were already available, such as reusable textiles. We learned that addressing the problems with medical packaging was a really complex issue which had global and systemic changes to deal with. And the really broad remit of the project helped to engage a wide range of the supply chain. However, we realized we needed a narrower focus to actively stimulate innovation in particular areas. For example, the specialist reusable theatre drapes. Now, waste management was a really key theme in the market feedback. And this led to the Trust initiating a second innovation procurement project, which I'll come on to after this one. Next. So the complexity of the problem of getting to zero waste theatres meant there were a lot of different areas for us to act on. We've got several of them shown here. From our market insights, we created an action plan with lots of different actions, different fronts that we need to tackle. Some of the things we knew we could do straight away, such as eliminating unnecessary use of single-use plastics, such as gloves. Other areas, such as the packaging, and getting toward moving to circular material flows required a much bigger discussion and action at a larger scale, working nationally and digging much more into the supply chain. Next. One of the opportunities we took forward for the market engagement was working with suppliers of remanufactured surgical devices and making procurement choices in favor of using them. We're already from that work seeing significant cost savings and reductions in carbon emissions. You can read more about this one in the case study. Next. So in conclusion, well, we've achieved considerable learning from going through this innovation procurement process. It's definitely influencing our approach to innovation and future procurements. This project has led to significant organizational change. We've established a formal decision-making pathway for sustainability, social value, and carbon saving projects that goes beyond the zero waste theatres. We've also established a trust governance route that enables business cases for zero waste projects so they can get approval and be taken forward. And most importantly, it's really given us the tools to bring in innovation to projects and address our future procurement challenges, such as in areas like catering and laundry. Okay, next. Thank you. So I think I'm going to jump straight into the next one, George.
Sam, I will just jump in for a second. I want to thank
sure.
you very much for that first presentation, which